Here
Sorry
I,
about that. I'll just record you.
so here I am in Auckland, where it's actually been very cold today. But anyway, and I've been through over the last week or two some of the latest research and made a few notes. So you'll have to excuse me if I'm looking at some of it on paper. So I'll be flashing the bits of paper around a bit probably, because the research, as you're probably all aware, gets more and more complex as the days and months go by. So you almost need a new degree to be able to decipher most of it. You're very lucky down in Dunedin. Of course, you've got Warren Tate down there, and his research is always very exciting. And what I'm going to be reporting on tonight is not Warren's stuff, because partly because it's way above my head anyway, but more importantly because he's local to you. You can no doubt twist his arm and get him to come and talk to you again at some stage and bring you up to date in perhaps more simplified language than I can manage. Anyway, so I thought, well, I picked out, what have we got? 15 different lots of research that have been reported in pretty prestigious journals over the last few months. And the good news is that the research is going on. I think long COVID has brought it much more to the forefront, of course, and people believing it more and so on. But also, I think the findings are such that each piece of research often stimulates another piece. So, you kind of it increases quite rapidly, really, the research, and some of it is very, very complex, um, beyond the understanding of most medical people. And that's one of the problems I think we're up against, that doctors really just generally don't understand the research. So find it very hard to keep up to date. But anyway, that's nothing new, and it's the same in every branch of medicine. So this is nothing unusual. Anyway, so here we'll go. The first thing I thought was very, very interesting is a study called the Decode ME. And this is based in the UK, mainly at the University of Edinburgh. And it's a huge study. They looked,
Live.
sorry? Oh, they looked at the DNA of 15,500 ME patients. That's a huge study. And they compared it with 259,000 people who hadn't got ME. And they looked at the differences in the DNA, which is the sort of gene structure. And they found that 8 regions of the genes were different in the ME patients. Some without ME had the differences, but this wasn't necessarily conclusive and was a small number. And these may, of course, be people who are perhaps more prone to going to get the illness, or maybe have it in a very mild form that they're hardly aware that they've actually even got anything wrong with them. Um, the genes related to pain and infection were the ones that were standing out, and the immune system and the central nervous systems were also implicated. So that was certainly a huge study. And, although it may not sound very much the way I'm telling it, it's considered to be a really, really important study, which is ongoing, doesn't just stop there. They will kind of take it further, I'm sure, and probably in another year we may well get some more exciting and conclusive results coming from it. The next thing I can report about a little bit is the so-called NICE guidelines, which you've probably heard about from time to time. They're based in the UK, and it proved quite conclusively, this particular latest study proved quite conclusively that cognitive behavioral therapy is not a particularly effective treatment for chronic fatigue syndrome, ME. Um, the trials that they looked at that had been done before found that the trials were not particularly reliable. There were financial interests involved, and the whole thing sort of undermined the credibility of cognitive behavioral therapy. That's not to say that cognitive behavioral therapy isn't useful. It's probably useful in absolutely every illness and in people who haven't even got an illness, because it's a form of psychological intervention, talk therapy, whereby you talk things through with a good therapist, and it does help you deal with illness, deal with life. It's not a ineffective treatment, but it's not specifically effective for dealing with the symptoms and problems associated particularly with ME. In other words, things like inflammation and chronic pain and sleep disorder and what have you are not really helped in a person with this illness by cognitive behavioral therapy. At the end of this talk I'm giving, we can have some questions. So, jot things down if there are things you particularly feel you'd like to ask about. The next thing that I looked at was the brain issue, so-called neuroinflammation, which is inflammation in the brain. And they found that this was significantly different to people who hadn't got ME, particularly the so-called neurometabolites. These are the sort of chemicals that are formed with using your brain. It's a constant, it doesn't happen just one off now and again. It's a constant process of metabolism within your brain. And that was very different in people with ME compared with healthy people. Again, you can't rely on these studies 100% because there will always be people that don't quite fit the picture. But I think on the whole, the numbers are such that it was very significant. So that again was a different slant on some of the things that have been studied before. So I'm hopping around really because I just went through the research and came up with the points of interest which I thought would interest you. Then they looked at the next study I looked at was looking at a chemical called haptoglobulin. And haptoglobulin sort of recycles the iron in your body. In other words, the iron gets used and then chemical actions occur that sort of bring it back to a usable state again after it's been used up. And they found that particularly this so-called haptoglobulin was linked very firmly to what we call post-exertional malaise, the sort of exhaustion, the total exhaustion that occurs in ME people if they push their bodies a bit too hard. Not just the body, sometimes the brain activity and so on. And this particular finding they found was associated also with low-grade inflammation. So there was sort of inflammation in the system as well as the issue of recycling of iron and post-exertional malaise and everything. In other words, it all sort of hung together in a pattern that was not normal in healthy people. Then we moved on, and I'm sorry I'm jumping all over the place, but that's how the research is. It doesn't sort of, it's not just one long thing that happens. It's lots and lots of different pieces of research going on all around the world, which some of them link up eventually, some of them die a death of proving to be useless. Some of them prove a major breakthrough. So all these things I'm talking to you about have been published in prestigious, good journals and are considered very worthy, but they still may find that someone will come along and disprove the research. That's what happens with research, really. Anyway, the next thing was a study done by Suzanne Vernon, who is a very, very well-known and important American researcher. She has a very large laboratory in America, and her main focus is this illness. And they looked at a new, well, not a new drug, but a drug that was new to this illness called oxaloacetate. And again, you don't need to write these things down because I can print this out in the next few days and send it through to Heather or whoever deals with this kind of thing so you can get the spelling and look the things up a little bit for yourself if you've got a computer. Anyway, she and her team used this drug called oxaloacetate, and they found they used it in long COVID patients, and we all know that long COVID and ME/CFS are the same thing, really. Just long COVID, of course, is proven to come from a specific virus as opposed to the many thousands of other ME patients whose illnesses have been very different. Different viruses have been the trigger. Anyway, they found that this particular drug had quite a major impact on improving fatigue and brain fog. And if used fairly early in the illness, before it gets long-term established, there was much more chance of some good improvement in the overall symptoms and the brain fog and brain ability. So again, this is very early research. You can't prove anything just with an initial study. You have to take it further and get another center somewhere else to do the study, so it's not kind of too biased and so on. But it certainly looked promising, and they were using 2,000 milligrams a day on patients, and using it, that they did a good study using it with patients and using a dummy pill with the so-called controls, so they could see if the drug itself was genuinely helping. A Canadian group, a biggish group there, used AI, artificial intelligence, and I don't really know enough about this really, and I don't suppose many of you do either. It's just a term that's getting bandied around and is becoming more used in all sorts of areas of life. They found that using AI, they could actually predict the susceptibility of people who might get ME. Now, goodness knows how they do it, but obviously it's computer generated work. And the comment at the end of the study was that clinicians are still very unsure of what they could do with the results. And even perhaps if they could even rely on the results. So, this sort of is very early stuff, but I brought it in because I think we're going to hear more and more about artificial intelligence and interpretation of laboratory results and all sorts of things. So it's something we need to sort of prick our ears up and start learning about ourselves, really. But again, these are very, very early studies. However, the next thing is very much more conclusive and useful. I'm sure all of you have heard of Lyme disease, and Lyme disease is possibly likely to lead to ME CFS. It's a disease through the farming community. And it's always been a little bit vague unless you find the bug that actually causes the Lyme in the first place. But the illness itself is very much the same as CFS, the post-Lyme results. And what they've found now is that there's a blood test that can be done in people with suspected Lyme disease, which is 90% accurate. And it's a very reliable study. And Lyme disease is treatable. It's, parasite which can be destroyed. So if a person is found to have Lyme disease with this very accurate new blood test, they can be treated, and there's a good chance of improvement, if not cure. So again, you can't run out and go down the road and get the test done, but it will become available in laboratories eventually, hopefully not the too distant future. So that's an interesting one and an important one, really. The next thing I'll tell you about is a little bit about if we go back to the first study I mentioned, the one called, what was it called? Decode ME from Scotland, Edinburgh. And some of the scientists there did further studies or have started to do further studies and found that there are genes that are linked to chronic fatigue syndrome, which are also found in many people with a chronic pain syndrome. So it's a question of whether these patients are actually the same group, the chronic pain people, are they suffering from ME? They have, however, said at the end of the study, it's a very small study, and it does dispute the notion that the illness is psychological, but it was a very small study and it may not be accurate enough to rely on, but it's certainly worth adding into the list of research that's going on at the moment that's considered very, very important. Next thing was, and I mean, I am jumping around here, I know, but I mean, that's the way research is. You kind of get something on treatment and something on diagnosis and something on psychological aspects and so on. So the research as it comes to the fore is very much jumping all over the place. So the next one is looking at another drug that could be useful for the chronic pain associated with fibromyalgia. And it's a long time since they've had a good new drug to trial. Up to 15 years ago, the last things were reported, and things like pregabalin and Neurontin and so on. Anyway, this drug is called Tonmya, Tonmya. It's said to reduce the pain considerably and improve sleep, which is associated with muscle relaxation, which is part of the way it works. However, the downside is this was a very small study by a small drug company. And so the benefit may not be as meaningful as it sounds. However, there were minimal side effects, and it will stimulate further research into medication, I'm quite sure. So even though it's a very small study, and I can't give you the actual numbers, but it was it's reported as being a small study anyway. So even though it's very small, it was enough to trigger off interest. And I'm sure some of the great big laboratories, particularly in the States, who have perhaps more money, will take on board some further research because it could be very, very important. Next thing will be furthering the next study I can report on is furthering the interest in what we call the orexin system. And the orexin system is all tied in with sleep, and it's found to be very abnormal in chronic fatigue syndrome. This was first reported on probably 7 years ago by Martin Partanen from Finland, who is a sleep researcher who's very interested in chronic fatigue syndrome. And he explained how this system worked and how it was abnormal in this illness. And it also led to all sorts of metabolic dysfunction. In other words, a lot of your ways your body metabolizes things is kind of screwed up. And he felt, and this latest study that people found too, that the orexin abnormalities are essential a central feature of ME/CFS, and it's obviously open for more intervention and attention. I think the thing that came out of the earlier studies, and it's still very valid, is that a snack at bedtime improves the way your orexin function works, and that snack should be have some carbohydrate in it. So, a sweet biscuit or a sweetened drink that can lead to improvement in the way the orexin system works and give you a better chance of sleeping more restoratively, which is one of the clues to improving the symptoms of ME. Um, Another study, and again, we're jumping all over the place, I'm afraid, but that's the way it is. I'm reporting these things roughly in the order that they came about. And this was one by Jared Younger, who's a very well-known ME/CFS researcher, and he's a neuroradiologist who looks at brain scans particularly. And more advanced scanning has come to light over the years. Of course, all these scientific things improve all the time, and found that people with chronic fatigue syndrome do have marked inflammation in the brain, both sides of the brain. A lot of inflammation in the brain is just one-sided, but in this illness, it's both sides. And it's almost like they're stuck in an infectious illness, even though they're no longer probably infectious. It's almost like they've had something like meningitis, which has kind of gone on. They haven't got meningitis anymore, but the brain changes showing up in this advanced scanning technique is very like a number of post-infectious brain illnesses. So again, I don't know that it helps us improve symptoms or anything like that, but it proves that there is something wrong. So all these people in the past who've said, oh, it's all in your mind, are being proven to be out of kilter. And this is a very real brain effect or brain illness, as well as affecting the rest of the body. Then a study of another drug, and I'll have to look myself at how to pronounce this one, bezisterim, Bezisterim. And this is a drug which, again, it's early studies, nothing, you can't go running down to the local GP and get it or anything like that. I don't think it's available at all on the open market, as it were, very much still in research, but it is a drug that turns off or tones down the inflammatory pathways that are occurring in long COVID particularly, but also it would apply to ME/CFS. So again, it's only just coming into the research category, but it may well turn out to be useful. I mean, one of the warnings I have about all these drugs is, first of all, they're probably none of them available yet in New Zealand and may not be for quite some time, and or they may be very, very expensive before they become manufactured to a stage of being able to just get a doctor's prescription for them. This occurs not just in this illness, this is general, the way that research into drugs occurs. Initially it's trying something out, and then once it's proven that drug needs to be manufactured in sufficient quantities that eventually it's no longer quite as expensive as it starts out to be. I'm only saying this to you to bring you, make you aware of the way things work. We'll talk a little bit about low-dose naltrexone, which I'm sure many of you have heard of and some of you may well be on. That's a drug that's very old-fashioned in a way now compared with all this rather high-powered modern stuff. Naltrexone has been around for long time, and the very low dose form has been used quite a bit in people with ME, chronic fatigue syndrome, fibromyalgia, and so on. And what it does, it improves the way, or at least this is one of the things it does, it improves the way that calcium moves in and out of every cell in your body, and particularly brain cells. So calcium is constantly moving in and out of all our cells all the time. And what the research group in Queensland, led by Sonia Marshall-Grazilnik, have had found, and I mean we are talking 5 to 10 years ago now, they found that the way calcium moves in and out of your cells is abnormal in chronic fatigue syndrome. So that's not a new finding, but low-dose naltrexone improves the way that the calcium moves in and out of the cells. And we say low dose because higher doses are not needed. So very tiny doses of 1 to 3 milligrams can be used. It's available in New Zealand, and there will be a percentage of people who have shown improvement. Not everyone gets improvement. Some people get side effects even from the very low dose, but you can get it through your GP on prescription, but you have to pay for it. And I haven't been practicing now for the last 2.5 years, but when I was practicing, it was working out probably about $8 or $9 a day, which, is quite a high chunk. Whether your health insurance would cover it, I've no idea because every health insurance policy is a bit different. But certainly it has improved the well-being of a number of people. It doesn't cure the condition, but it helps you manage it better and feel better. Um, so it's well worth thinking about if you have a doctor who knows enough about it and is willing to prescribe it. It's very safe. And you need, some people, I think in Auckland, when I was prescribing it, we had a company that were charging about $56 a month for it, which is quite a bit less than what I quoted just now. But anyway, that's something to think about and something to be hopeful about too. The final one I'm going to talk about is another drug called, and I have to work this one out how to pronounce it, soltriamfetol. Soltriamfetol. And this, again, is a very early study, only just being repeated, and it's considered very safe with potential, and it's been mainly researched overseas, of course, so it may well not be available here for a little while, but it has been shown to improve fatigue in about 8 weeks of use. So again, I can't tell you how much it costs or whether it's available here yet or whether it will be available, but it's just important to understand that all this research is going on, and it's giving us a lot more hope of ways to understand the illness and ways to also deal with the illness. So, there's a lot of hope out there. And I think the other good thing to report, well, several good things, but particularly some of the researchers who are involved in this illness are some of the really top grade researchers from around the world. I mentioned Sonia Marshall-Grazilnik and her team in Australia, and Suzanne Vernon in America, and there's Anthony Komaroff, and lots of really, really top-rated researchers from around the world who have got themselves really interested in this illness now. The other thing that's interesting, more close to home, is that about 10 days from now, there's going to be a gathering of clinicians in Auckland and of some scientists in Auckland. I've been invited. It's an invited group of about 20 people who've been either involved as doctors treating the illness or as scientists dealing with the illness. And we're having a sort of all-day symposium to bring us all up to date with what's going on, sharing knowledge. Warren Tate's going to be involved. He can't get to Auckland, but he'll be on the link. A computer link, and several other people from around New Zealand who've been closely involved in dealing with the illness will be on computer link. And I think there's about 20 of us gathering in Auckland, including a very well thought of immunologist, one or two people who are in what I would call very alternative aspects of medicine. They're all doctors that are coming. So it'll be interesting to hear the alternative side of things too, because sometimes that's very different, but it can lead to quite exciting research sometimes when someone says, oh, I've tried such and such, and, my patients have done really well on that. So, the whole day symposium is quite an exciting moment for New Zealand, and it's not open to the public. It's by invitation only. So it'll be very interesting to see what the outcome of all that is. I think it'll be written up in some way afterwards, so I'll have access to that and can perhaps have another session with you people and try and interpret some of it a little bit more carefully. As I say, the science is almost beyond me sometimes. I mean, Warren Tate's stuff is really, really exciting, but you have to be a high-powered scientist to really understand what it's all about. You probably also know that he's recently had a book published with another researcher from Dunedin, and this is being widely acclaimed around the world as a potential textbook of this illness for medical schools. So that'll be a big breakthrough too. So I think I'll stop talking there and hope that you might well have some questions that I could try to answer, or comments you might like to make. We can open the floor anyway. So I don't know if Heather's still there to run the show.
Yes, any questions for Dr. Vallings?
Oh,
I'd
hello,
just like
yes.
to also say I've muted everyone, so if you want to talk, please unmute yourself first.
Oh, yes, that's important. Otherwise, you just see moving lips.
Yes.
So any thoughts, comments, or questions? We don't have to stick to the agenda of those things I've gone through. If you've got other questions you want to ask.
Could you stop the recording, Kerry, please, and then
Yeah.
start again? Thank
That's
you.
right.